police, courts, and the individuals who are seeking help to banish and control the active addiction part, rather than getting curious about its behavior and motives. Since addiction rates are setting records every day in the United States and around the world, banishment and control efforts clearly backfire. In this book, we propose a different treatment for addictive processes through the lens of internal family systems, IFS, which flips the prevailing approach to treatment on its head. Rather than exiling their addictive part, clients are encouraged to listen to it, learn how it has been trying to protect them, and honor its efforts. At first glance, this seems dangerous and counterintuitive. Why honor a disease or a compulsive, self-destructive habit that is ruining someone's body, their family, and their life? The IFS approach only makes sense if you buy into one of its basic premises. This behavior is not evidence of a disease, nor is it the uncontrollable habit of a weak individual. It is the choice of a valuable inner being, a part, who was desperate to save the client at some point in their earlier life and, thinking it must continue to do this job or something terrible will happen, got stuck in that protective, now destructive, role. In other words, often, addictive parts are desperately trying to distract or numb you from vulnerable emotions such as pain, shame, and terror, or they're trying to keep at bay other scary protectors like self-hate or suicide. Consequently, in some cases, what they are protecting must be healed or changed before it is safe for them to stop their activities. Everyone has addictive processes. Even if you don't drink too much or use drugs in a problematic way, you do something else. Maybe you watch too much TV when you're overworking, or you eat too much when you're sad and then restrict later. Addiction signals a normal balancing act that is now too extreme. We are well versed in the traditional approaches to addiction, and we are highly experienced IFS therapists who have worked with many forms of addictive processes. In this book, we explain the differences between treatment paradigms and offer many illustrative examples. We also give clear guidelines for negotiating a ceasefire between a client's cautious, shaming, managerial protectors and their rebellious, compulsive, addictive protectors. And then we get permission to go, with the curiosity and compassion of self, to the frightened, shocked, shamed parts who are being protected and who need to be healed. Additionally, we include experiential exercises that aim to help you, as a therapist, get to know and appreciate your parts who become polarized around addiction. And the same exercises can be used with clients. We also introduce and illustrate an inner conference table technique developed by Cece, which is very useful with highly enmeshed and polarized systems. The IFS model has become very popular and influential over the past decade. At the same time, addictive processes are complicated, and we therapists are far from immune to our culture's negative beliefs about addictions, which, due to poor treatment outcomes, are commonly seen as very hard to affect. As a result, many IFS therapists continue to believe that clients who reveal an addiction should be referred to traditional treatment centers or specialized therapists. A revolution has been taking place in addictions treatment, including in some IFS-based treatment centers, and this book argues for doing things differently. After countering the negative biases about addiction in our culture and in the field of mental health, this book invites you to take a non-shaming, depathologizing, compassionate stance toward parts who are engaged in addictive processes. If you accept this invitation and find that your clients do better when their parts feel validated, acceptable, harmonious, unburdened, and loved, we hope that you and they will spread the word. That message is worthy of a revolutionary movement, and we are glad to be part of it. Introduction. Addictive processes affect people's body, mind, and spirit. When people engage in compulsive, repetitive use of substances or practices like gambling, porn, high-risk sex, and over- or under-eating, it affects their physical health, reconditions their brain, and generates despair.